Hello, you're welcome to the teacher channel. Thank you for visiting the channel. I'm so excited you are here. This short video is just to, get you excited about what we do. One of them is standard first aid and CPR level C training. This is an exciting course where you learn a lot about life, about saving life, about many things to do to prevent emergency if you are able. Of course, you know that sometimes you can actually prevent some things. In some other cases, you may not be able to do anything, but you can do something when emergency happens. So this course is going to prepare you, get you ready for, emergency when it happens. So standard first aid is the initial, the basic care, the emergency care you give to a person who is ill or sick. So for you to do that, you must have the proper skill set. You must know what to do. You must know how to recognize the emergency. You must know when to know that something is not right. And that is not the only thing. You must know what to do. So that thing to do, is what we call first aid. There are three objectives. First aid has three objectives. Number one, to preserve life. Number two, to prevent injury. And number three is to promote recovery. And the person who is providing first aid is called first aider. First aider or first aid provider. The person you are helping, is called the patient, the victim, or the casualty. So those three terms are used to qualify the person who is in need. And so you, as the first aider, you have some obligations that you must adhere to, and one of them is that you must use reasonable skills. Number two, you should not go outside the scope of first aid. Number three, you must obtain consent, permission before you start. Number four, you should not abandon your patient. Don't abandon your patient. And then number five, you must protect the privacy of your patient, Remember that in some emergency, you need to call 911. Some you may not if it is minor emergency. In that case, first aid alone is enough. But if it is a major emergency, then you need to call, the EMS to come and provide advanced care. Remember, in first aid, we don't provide advanced care, we provide basic care. But that basic care is very important, very, very important, because it is capable of, preventing, the situation from aggravating, from escalating. So very basic, but very important. So you're welcome. This is going to be an exciting class. I want you to come prepared, come ready, come excited. You must be excited. Bring your writing materials. A lot to be said. You will know a lot. It is an eye-opening session. You'll be told many things, many strategies. Get you ready, get you equipped. Knowledge is power. That is what we are doing here. We must get you equipped so that when emergency happens, when it comes knocking, you should spring up and respond. You must respond. You cannot fold your hand and leave that emergency unattended. Because if you do so, that is going to leave that person in a very critical, worsen the situation. There are many topics we're going to cover. Number one of them, emergency scene management, which builds the foundation for what is to come. We are going to cover shock, fainting, unconsciousness. We'll talk about bleeding and wound care. We'll talk about asthma. We'll talk about allergic reaction. We'll talk about head injury, spinal injury. We're going to cover, diabetes. We're going to cover seizures. We're going to cover cardiovascular issues, respiratory issues. And that topic, we're going to cover CPR, cardiopulmonary resuscitation, which you provide to somebody who has cardiac arrest. We're going to touch on heart attack, ischemic attack, transient ischemic attack, angina, high blood pressure. We're going to talk about many things. We're going to talk about, environment-related emergencies. We're going to talk about burns. There are 5 categories of burns: chemical burns, electrical burns, thermal burn, radiation burn, inhalation burn. There are 3 degrees of burn: first degree, second degree, and third degrees. We're going to cover many things. How do you take care of somebody who is having seizure? How do you take care of somebody who has high blood sugar, high sugar level in the blood? How do you take care about somebody who has low level of sugar in the blood? We call hypoglycemia. How do you take care of somebody who is shivering because of hypothermic situation, somebody in the cold or somebody in the hot environment, and the person is experiencing, heat stroke or even other variations or heat emergencies? What do you do? What do you do if somebody bleeding? What do you do if somebody is in emergency of any kind? So those are important questions that we must answer when you come to the class. So please, I expect you to come excited. Our instructors are ready. And you can see our classroom is very cute, very comfortable, small size, but very, very, very comfortable. Very comfortable, very comfortable. You will really enjoy it by the time you finish. I'm sure you will have been fully equipped, fully knowledgeable in emergencies and what to do when they happen. So you're welcome. You're welcome. You're welcome. I look forward to seeing you in the class. And please, you can subscribe to this channel. If this is your first time coming to this channel, you can like the videos. There are many other videos you can find here. Many other videos. Please do well to subscribe, like the video, share the videos. And I look forward to seeing you in person. I look forward to seeing you visit this channel again and again. Thank you very much. See you soon. Bye-bye.